Hi, my name is Glenn Zipka. I'm the Deputy Director over at the Health Media Collaboratory. We're located over in Chicago at the University of Illinois at Chicago. And today I'm going to be talking to you about what Twitter can tell us about quitting smoking, and more generally, how to use social networks to study health behavior. And you can also apply what you'll learn today and just how to run your own analysis of Twitter and or any kind of other social data platform that you're working with. Who am I? Again, I'm Glenn Zipka. I've been using social media since around 2007. Facebook, got on Facebook was one of my first networks that I used, and then later on, I went to a couple of years later. I went to South by Southwest Interactive, and just really discovered the wow of social media and how it can be used in a public space. I really hid behind my privacy wall, but I really discovered that, particularly in Austin at South by Southwest, really how to use social media and just the power of social media. And so then I just started getting involved in other platforms. So here are some of my profiles using some of these social media platforms. So just a brief roadmap of where what we'll talk today about. We'll talk a little bit about the Health Media Collaboratory, why we do this, what we do, and how we do it. We'll talk about how to do social data research, how to use social data platform, and particularly how doing this research really can affect your data and how to do it properly. And then we'll get into specifically looking at what Twitter can tell us about quitting smoking and the social support on Twitter for quitters. And this is where we'll use some of our Tableau workbooks that we've been using in our analysis. And then we'll just recap of what we've learned. The Health Media Collaboratory, we're quite new. We've been around for 2 years, although we've been doing research on media and health for around the past 13 years. Our main mission is data for public good, and we realize that these forms of communication can really saturate our society, and mass marketing can really promote unhealthy behavior and can contribute to disease. But we really believe that you can harness big data, harness data for the public good, and this can really impact your health behavior of individuals and communities. If you want to go visit us, you can visit us at healthmediacollaboratory.org. We have an active blog where we kind of talk about what we've been learning in social media, particularly around tobacco use, although we've been exploring other areas like obesity or drug use. Here's an example of one of these blogs. We do a lot of research on e-cigarettes. E-cigarettes is this new phase, and what we've really learned, in particular, is slang. So now, what young adults are calling regular cigarettes, the ones with actual smoke, are actually analog cigarettes. And so we really learn the new ways people are using slang. So I invite you to come to our website to learn about us and see what we're researching. So we got our start working with evaluating anti-smoking campaigns on television. We've been doing this about 13 years. You may have seen Debbie. She just recently died. She had an ad that she smoked through her stoma. Another popular campaign was the Truth campaign. It's been quite a while since their ads were on the air, over 10 or 11 years, and they really championed, really coming up with a brand, anti-smoking brand. And just quite recently, we have the CDC Tips from Former Smokers, which is one of the first national federally funded campaigns to reduce smoking. And you might have seen Terry, who has a tracheotomy, and because of that stoma in some of the advertising. So we've been looking at this advertising for 13 years. So we have this health behavior change model that we've been working with pre 2011. Even looking at demographic controls. What affects our health behavior? What affects outcomes? Even before we are born, you're predisposed to health behavior. Based on your socioeconomic status, the region that you come from, your ethnicity, your age, all this factors your health behavior. And what also factors it are these contextual policy controls, secondhand smoke laws, tax. This also has an effect on whether you smoke or not, or your health behavior. Now, when you're looking at when we looked at message exposure, and this would be messages from TV advertising, they can have a direct effect on the outcome of your health behavior to make you stop smoking. Or a message exposure can have really a mediated effect on attitudes and beliefs. Seeing an ad makes you believe that smoking causes cancer, and that will affect your outcome and make you stop smoking. So this is this is a typical health behavior change model. There are a number of these out here, but this is what we were operating on in 2011. And using this model, we came up with a significant finding. Both some studies that we've published, both tobacco and pharmaceutical companies. Pharmaceutical companies would be those companies that sell nicotine replacement therapies to help you reduce your smoking. And we found that they were the really largest smoking-related advertisers, as opposed to states or federal government with their anti-smoking advertising. The money is really in the tobacco and pharmaceutical companies. Another thing that we discovered is that anti-smoking ads are associated with more anti-smoking attitudes, beliefs, and less smoking among youth. And so in the end, the more anti-smoking ads you see, the more likely that you're going to quit smoking. What we also found is that back in the early 2000s, that tobacco industry ads, they had their own anti-smoking ads. Philip Morris and Lorillard particularly, they had a boomerang effect, really. Their ads, interestingly, did not make people want to stop smoking, and actually it increased their actually smoking. And what's really interesting about this is that we thought that the tobacco industry was intentionally really creating bad ads. So during this research, and during our 10 years of studying just advertising exposure, social media really exploded. And so those patterns of media consumption really changed dramatically. So in 2013, we had nearly universal internet use. 85% of adults use the internet. 70% of homes have broadband. 56% of adults own smartphones. 91% of internet users search Google for information. And now Google is actually a verb for searching that information. 72% of adults use social networking sites, Facebook being the largest. 18% of adults tweet, this is up from 8% in 2010. Most viewers that watch TV dual screen, so they have their iPad, their Android device, their iPhone, and they're tweeting about watching TV. Scandal being one of the most popular type of social TV out there. And then we're using social media everywhere. In fact, Nielsen just came out with a stat that 32% of young adults actually use social networks in the bathroom. So the need to account for not just exposure now, but for searching and sharing of tobacco-related tobacco-related information and the actual interaction of each we really needed to account for, and we needed to change our model. You know, and specifically for the internet and health, 72% of internet users look online for health information, and we're doing, what are these people doing? They're diagnosing disease, looking for treatment for their disease, and also looking for doctors. And, you know, 46% of these people that go online to look for a diagnosis actually seek medical attention. And their diagnosis that they find on Google or any kind of search engine is medical professionals actually confirm those online diagnoses. So they're really finding some correct information out there. So we have this all going on while we're studying our exposure, and we really just needed to change our model. So we have this new paradigm that we work with. It's got the same demographic and policy controls, but now we have this interaction of exposure, search, and sharing with health behavior. So a person might see an anti-smoking ad on TV, and they might tweet about that ad, and say one of their followers would read that tweet, but did not see the ad, but they might go on YouTube to look at that ad. And after viewing that ad on YouTube, they go to the internet to possibly look for information about quitting. So we have exposure, search, and sharing really interacting with each other and with health behavior. And this kind of all feeds back and forth. So we have this new paradigm that we're seeing when it comes to health behavior and outcomes. So thinking about this, we applied for this multi-million-dollar grant with the National Cancer Institute. Dr. Sherry Emery is the principal investigator and my boss. And our team, we really had two goals that we really wanted to look for. We wanted to develop an understanding of what was out there, the amount and the variety of tobacco-related information for both smokers and non-smokers across all media platforms, social media, and also television. And what's interesting to this, particularly with e-cigarettes, is that you haven't seen a cigarette ad on TV since 1971, but cigarette companies like Blue, now you regularly see those on TV. And how does that really affect our use, and how does it affect quitting behavior? That's something that we're really looking into. And we also, in addition to that, we wanted to analyze that relationship between the information we get from this new media and how it relates to our attitudes and beliefs about smoking behavior. So we developed a way to collect these archives, and we developed an archive of social media data, the Tobacco Library Archive, where we collect data, social media data, on tobacco-related behavior, on marketing. This could be pro for cigarettes or anti-tobacco marketing, and policy data. We do social media data from the federal government or state agencies. So we started this curation in early December 2011. We're approaching nearly 2 years on this, and we've collected over 100 million social media units. We haven't read all of them at all. And I've listed some of the popular ones that we collect on. We collect tweets, we collect Tumblr posts, we collect YouTube videos and comments, we collect Facebook posts, and also the D there. Discuss is a really nice platform where you could, every news media site and every blog now has a comment structure where people can comment on it. And so these comments are actually hooked up to a social data feed where you can actually look at what people are commenting about. So these are our major ones that we collect on, and we have over 100 million of these units. Now the question is, how do we build this archive? And so let's talk about how did we get here, and how did we discover these tools to collect social data? That's David Byrne from Talking Heads. So how did we get there? Well, you need to really make a first question that you should really ask, and it's what Morpheus asked Neo. You have a choice here, and you could take that blue pill of yours, and you could believe what you want to believe. And I'm not knocking companies like Radiant Six or Crimson Hexagon. They certainly do a great job, but they're going to provide answers for you. And us, for data researchers, we really wanted to conduct our own research, work with raw data, and come up with our own findings. So we really wanted to jump in that rabbit hole and see how far it goes. So we took that red pill. We worked with a number of tools, companies to do this, DiscoverText, and Tableau for our visualization. Not certainly endorsing these companies, but I think discussing how we work with these companies will give you a good idea on how to do this research. So the first thing that we discovered is that, especially for me, is that I'm not a data scientist. At the time, kind of funny, in 2010, social data was big data. We had 50 million tweets per day. This has actually gone up to 500 million tweets, so it's really changed over the years. And because of this big data, we couldn't use our traditional data collection tool. That would be a lot of graduate students that we'd have to pay to copy and paste. But what we discovered is that every social data platform has an API, something called an application programming interface that you can access through software and collect this data. And this collection, you can hook up these social data feeds to pull in this data quite easily and quickly, because it's all text data. So just in working with APIs, the first thing that we discovered were a couple of the Twitter public APIs. They have a couple, both the streaming and REST API. And so this is free data. We were very excited because we had free access to this data. It was available. But what we discovered is that the access was rate limited. You could only access these Twitter data streams a limited amount of time, and more importantly, this data was sampled at 1%, and it's really a black box, because we really don't know if it's a random sample or how they're collecting this data. And the reason why this was concerning to us is that people don't talk a lot about public health in social media, on Twitter, and also policy issues. That conversation is going to be low when you compare the tweets with large popular culture phenomena. Like, say, let's talk about Justin Bieber. Justin Bieber has 43 million fans, while the CDC only has 180,000 fans. So when you're talking about that 1% sample, you might not collect enough tweets off the CDC stuff to make a really informed analysis. So to us, we needed to get every tweet. So every tweet really mattered to us. So we went to we found this company called GNIF, and they provide access to social data streams. I consider GNIF kind of like a social data plumber. They're an aggregator. So they go out to companies and collect their data streams for a charge. And some of the most popular ones that they have is they have data streams from Twitter, from Tumblr, from Discuss, GetBlue, an up-and-coming popular 2D social media platform, blogs like WordPress, Foursquare, really recent platform that they've allowed access to, which is great to look at geolocation data. And what's more important in the case of Twitter and these other ones is that they work with these companies directly. So you get a certified product. You know that the data that you're getting from Twitter is going to be accurate. So like I said, we really needed that access to that full Firehose of social data. We wanted to be just drenched in that data and get 100% of all these tweets and have access to 100%. Another issue that we discovered is that, you know, it transmits data over a network connection between a server and a web application. And so the way to transmit this is through computer script, usually in JSON. And it's not a CSV file. You can't feed that into Excel or Access or SAS text analytics. You really need to turn that into a CSV file. So we had issues of what to do with these streams and how to capture that data content. We really needed to transfer this computer language into text content. So we found a product called DiscoverText, and it was really helpful. There are other products out there that do the same. DiscoverText is really like a Swiss Army knife for text. It allows us to just capture the social data, to filter it, to deduplicate it. Sometimes we have, because in social data you have multiple retweets, the cluster around certain topics, to go into a million tweet file and search for information, and also to human code and machine classify large numbers of units of text. So, you know, when you have a tool, when you're searching for this information, you know, when you're searching for social data on a platform, let's just say we work with Twitter here, you need to run a word query first. So that's something that DiscoverText allows us to do. It's hooked up to the full Firehose of Twitter, so we can enter a rule like smoking and then collect every tweet that contains the word smoking. Then after we go through these, after we collect through these rules, you're going to start gathering massive amounts of tweets. So you need a way to archive and bucket. You know, you might get a smoking tweet, and you might want to arrange and bucket different types of information from smoking. So DiscoverText allows you to work with files and buckets to arrange them for your data analysis. It also allows you to go into those buckets and run keyword searches in those buckets. So in this example, I ran the keyword search for quit in the smoking archive to collect tweets about quit smoking. Now finally comes classification. You can't, when you're working with 51 million tweets, there's no way that a human coder can code for tweets. So what you really need is you need the best of both worlds. You need humans and computers, and DiscoverText has an active learning algorithm, which is machine-based learning. So a machine will look at how humans code and will learn from that. And through sampling, it allows you to apply coding to massive amounts of tweets. So what we have here is really humans and machines learning together. And this is particularly, you know, when you're working with big data, you often come to this issue, and this is one good way to solve it through this type of active learning, and particularly for smoking, right? So smoking is a very ambiguous word. It could be many things, and like I said, we have 51 million tweets. There's no way that we can human code. We want to study smoking tobacco specifically, but because it's ambiguous, we really need a way to sort out all this information. So for instance, in the top picture, that's somebody smoking a cigarette. However, people smoke other different things. They smoke marijuana, or they actually, people tweet about food and cooking of food, and they might smoke meat. So we really need a classifier to look at all this these tweets, all this social data, and really disambiguate, and so we can make the proper inferences. We want to talk about when we do our analysis, we want to analyze the way people are quitting tobacco and not quitting smoking marijuana or quitting smoking meat. So when you look at all these data platforms, not all of them are alike. There are some, there are some limitations. Some questions you need to ask yourself in looking at these platforms. Certain different demographics use them. Some of them don't have an API, so you can't access the data. The type of data you get from social data platform differs. The privacy settings on some of these platforms are different, and whether how much data can you collect, and finally how and what do people really share on each of these platforms? They really differ. So let's take a look at just some of the broad demographics around social media users. 72% of adults use some type of social media. The popular one being Facebook. Let me add this. A lot of this data comes from the Pew Center, and specifically there's Center's Internet and American Life Project, and I encourage you to follow them on Twitter or get their emails. You really learn a tremendous amount of information from them. So like I said, 72% of users, of adults, use Facebook. The skews towards women and young adults. Twitter, 18% of adults use Twitter, used towards African Americans and urban residents. Pinterest, very interesting data platform, popular with women and adults and older adults. However, they don't have an API right now, so it's really impossible to access their data. And also Instagram and Tumblr, which are used by young adults, and they're kind of lower in the spectrum at 13 to 6%. For teens, somewhat similar. Higher use, 94% of teens are on Facebook, 26% on Twitter, then Instagram. MySpace, haven't really looked at MySpace, but as you can see, that's rapidly declining and not a very good social data platform to look at. So let's look at a few of these social data platforms. We have we have Facebook. Some of you, maybe some of you follow George Takai. He has over 4 million fans in earlier of this year, and it's just really a good example of Facebook. And so Facebook, like I said earlier, is one of the most widely used social network platforms for among adults and tweens. 72% of adults are on it, 94% of teens. Facebook does have a public API, but however, a lot of users are behind a privacy wall, so it's impossible to access their information. I think the Pew just recently came up with this finding that 60% of teens Facebook users keep their profile private. So there's some issues with collecting on this platform. Might not be a proper sample. You can't really generalize, and there really could be systematic differences between privacy and non-privacy privacy users. So it might not be a good platform to collect information on. I really like Tumblr. as a platform. It's pulling many users away from many young users away from Facebook. And considering the fact that Tumblr is a public and open platform, it's intriguing that young users are attracted to it. But users are not sharing on Facebook, but they're sharing a lot of information on Tumblr. And what's interesting, I mean, as you can see, they're sharing a lot of marijuana use. A lot of people talk about using marijuana on Tumblr, and I believe this is where we're going. This is probably where we're going in the debate within for legalization. But we see here it's still illicit, but people share information. So as a platform, it's low, 6% but growing. It's really popular among adults. The content is really image heavy. Not sure if you know who Little Bub is. He's one of my favorites. And this is an example of a GIF. So it's really image heavy. Lots of photos, lots of GIFs, lots of video. And it's also aspirational. People are talking about themselves and who they want to be and who they want to become and what they want to buy. So brands are really interested in Tumblr to see what people are talking about. A lot of this content, I think, because GIFs are difficult to create and videos are difficult to create, and so are photos to be created, and so it's easier just to do a tweet on Twitter. So a lot of this content is shared. 90% of the content is shared on Tumblr. So that means only 10% of the content is new. It does have Firehose API, so you can collect 100% of all Tumblr posts. But because the content is image heavy, this might confound your data collection. Right now, all our tools are based on text, and so we don't have a way to really capture right now, a way to capture images, to search actually images. So I'm sure that problem will be solved relatively soon. So what this leaves us with then is Twitter. Twitter is very popular social platform. 18% of adults use it. That's grown since 8% in 2010. 30% of young adults use it, again grown from 18% in 2011. And 24% of teens use it, and this has grown since 16% in 2011. It's used towards African Americans and urban residents, and this is probably why it's more common to access the internet via smartphone with these groups. You know why Facebook might be the largest platform? Certainly, Twitter is the fastest growing platform. We have over 500 million users currently. The monthly number of active users is 200 million, and on average, we have 400 million tweets per day, which is really a lot of information. So that's reason, and that's because of this reason why that people call Twitter the world's largest focus group. I like Twitter because those tweets are concise and fast, 140 characters. They're really easy units to collect and to analyze. When you're looking at a blog or at some of the social media, you're not confined 240 characters. And so they're really concise and makes analysis quite easy. And also, tweets express those immediate feelings and emotions. You're sitting there with your phone, and there's no filter. You're not creating a blog post, which involves a lot of thinking. You're really talking about what's on your mind at that time. So there's no filter. So let's look at what's in a tweet. Now, a tweet is actually more than 140 characters. You know, when you look at that front end of the tweet, you get the text of the tweet. You see a user's name. You see a user's Twitter handle. You see a date and any replies. But there's a lot going on at the back end of this tweet. And that back end is called metadata. And this is, I pulled up a field from the back end of the tweet to show you what kind of information that we can collect. We know what country the tweet originated in. We know the number of followers that tweeter has and a number of friends. Each tweet has a specific ID. We know their cloud score. Some people like cloud scores, some people don't. But this is a measure of your influence in social media. We have the actual link to the tweet, and also we get the coordinates for the geolocation in addition to in the city. I have to say about geolocation, not a lot of people use them. It's on the range between 1% and 5% that geolocate their tweets. This is changing now with more access to smartphones and apps that require to use their geolocation. We have the posted time of the tweet. We get their real name. In a sense, this is usually not their real name, but this is what just their real name, what they call themselves. Then for us, we have an indication of this type of rule, the search rule that we use. In this case, we use smoking with our keyword search. So we collected this tweet off of that keyword, smoking. Then we get the source. You know, what were they using? Were they using an Android device? Were they using an iPhone? Were they using an iPad? Or were they on their computer? So we know we can tell where they're using their social media. We have an indication of status count, 18,000 posts. This person is quite an avid user of Twitter. We can also have we get their bio. The bio is searchable too. So if you wanted to find out people tweeting about or in their bio, or not tweeting, but people talking about themselves as smokers or as quitters or really anything, you could search these bios. Then we have a user-defined location. This is what the user defines where they live. So in this case, this person is in an ocean state. Then we have access to their Twitter page. We know what that is, and also their user name. So we get a lot of information about what is going on with at the back end of these tweets. In addition, we also get whether they mention another user, do they use a hashtag? That's another metadata field, and also any kind of embedded links. If they were tweeting about a YouTube video or a news article, we would get that link too. So let's move on to what Twitter can tell us about smoking. So let's just kind of go over our data collection effort here. We accessed our smoking archive in January of 2013. Now these are tweets that we collected with the keyword smoking. At this time, we had 31 million tweets with over a year of coverage. Now to collect about quitting smoking, we went through and looked at these filters. We went through these tweets and searched for the word quit. We collected 1.7 million of these tweets, and we exported them into a CSV file and then into Access, and at which point we connected that Access file with Tableau. And so we were able to use Tableau to look at some of this data. So where in the world are smokers tweeting about quitting? The largest center here is really only 200 tweets in one location, and as you can see, out of the 1.7 million tweets, only 18,000 of those had a geolocation, so only 1%. People, as you can see, people are tweeting on the East Coast a lot, in the UK, and also in Indonesia. But you know, you really can't say much about this because of that 1%. There could be some really systematic differences between users that share and not share their location. We look at the United States. Again, we see what you see here is that the largest 74% of those tweets that had a geolocation came from the United States. So the United States had 74%. They led the way. And again, I'm not sure we see a lot of people tweeting on you know, particularly on the East Coast. But what does that mean? Does that mean that these are stronger, they have stronger anti-smoking advertising there? You know, is this a Bloomberg effect, or is this just people that in New York are connected more to geolocate their tweets? So you know, there's only so much information that you can get when you get such a small sample of geolocation. And I always, when I look at analyses, I always look to see like what's that percentage of geolocation that people actually are saying where they're tweeting from, because that can really affect your analysis. Another interesting thing we did with Tableau is put it on a histogram. So as you can see, the average is right around 20,000 tweets. And what did we learn? So we learned that users tweet about quitting smoking during quit smoking holidays. You know, beginning of the year and end of the year. They're talking about, you know, their New Year's resolutions. Then there are also other, you know, smaller or other holidays that are organized by, you know, groups like Kick Butts Day or the CDC Tips Launch actually happens in early March, or the Great American Smokeout. So what we found is that, people are tweeting around these significant days with, you know, advertising campaigns. What really interested us is in the second week of March, we had 80,000 tweets about quitting smoking. And so we were able to use Tableau to dive into these tweets. And what we learned is that this woman, her name is Amanda, and she tweeted, "My boyfriend said if I get 100 retweets on this tweet, he will quit smoking cigarettes. Please help." So Amanda's retweet was responsible for over 60% of quit smoking traffic during the second week of March. And as you can see, by getting 54,000 tweets, Amanda's boyfriend received support from the Twitter community. So that got us thinking, well, who else is, you know, what about social support on quitters on Twitter? The first thing you should know is that although Google is the top search engine, many users search for information on Twitter. It would not be out of the ordinary for a person wanting to quit to seek support on Twitter by just searching for quitters on Twitter. So we looked at these, our 1.7 million tweets, and what we noticed that we had 995,000 users. So we really want to look at super users, who's tweeting the most. And so we defined as super users as any user that tweeted over 100%. So we found 380 of these super users. And, out of all users, they made a very, very small proportion, only 0.04%. However, these super users tweeted 357,000 times, or over 20% of total tweets. So quitters seeking support on Twitter, the likelihood is that they wouldn't encounter one of these super user tweeters. So who are these super users? So we dived down, we looked into these super users, looked at their accounts, and we found that 90% of all the tweets that we collected were really spam. The first one is a suspended account You know, Twitter does a great job at finding, you know, tweet bots that are just selling advertising and spam. So it's more likely that the 60% of these super users were just spam accounts. The other ones, the other 30% were active spam. The next most super group is e-cigarettes at 4%. And what we find with these tweets is that these are e-cigarette advertisers really using searching for quitters in Twitter to get them to go over to your website. If they want to quit, why don't you try an e-cigarette? Then also we found some quitters out there that are actually quitting smoking, and they're tweeting about this a lot. So these are just plain old individual quitters talking about trying to quit smoking. And then, you know, less than 2%, you know, 0.07% were tobacco cessation organizations like QuitNet, CDC Chronic, or Tobacco Free Florida. So a very small percentage of actual tobacco cessation organizations. And then finally, NRT Pharmacy, so nicotine replacement, they have some presence on Twitter. You know, somebody searching for quitting might find a cessation pharmaceutical product, and this would provide a link. And then finally, there were people just kind of strange, encouraging people to not quit smoking, and that it was just a great thing to do. So what are the implications for this? You know, so there's little support for quitters out in the Twitter sphere, and what support out there is commercial rather than scientifically informed or originating from healthcare providers. Tobacco cessation advocacy organizations really need to take advantage of these holidays, like the Great American Smokeout, like Kick Butts, and also around those folks that are tweeting their New Year's Eve resolutions. They need to do this in order to expand the reach and really provide social support. You know, these organizations really need to be like Amanda and helping her boyfriend. They really need to engage these smokers that are trying to quit on Twitter. So what have we learned? You know, we've learned this new media paradigm. It's not about exposure. This probably applies more than just the health advertising. You know, this applies to media. People are being exposed to not just exposure, not just media messages, but there's also an interaction between search and sharing. So you really need this new media paradigm is really occurring before it's of exposure, search, and share. We talked a little bit about the types of popular social media platforms and how there's some differences in data and demographics. And you really, when you're studying and asking a research question, you really need to see, you know, how these platforms are used and what kind of data you can get. We talked a little bit about how to conduct social data research from the beginning of collecting to the end, through analysis. And you can really use social data platforms to study health behavior. It's, you know, we have 500 million tweets a day, and people talk about health behavior a lot, although this discussion might be very low. And finally, I think that, you know, Tableau is not just an awesome data visualization tool, but it also helps you uncover meaning in your data. You know, we looked at a histogram and we realized that we saw these peaks of these tweets, and we were able to dive into them and see why you know, what was going on with those. So I just want to say thank you to Tableau, and thanks for having me here.